Which of the following is not a vital signs? Option A pulse rate, option B respiratory rate, option C blood sugar level, option D blood pressure. The correct answer is option C blood sugar level. Vital signs include temperature, pulse, respiration and blood pressure. Blood sugar is important but not a vital sign. Blood sugar level is not a vital sign. The normal body temperature in Celsius is option A 36 degrees Celsius, option B 37 degrees Celsius, option C 38 degrees Celsius, option D 39 degrees Celsius. The correct answer is option B 37 degrees Celsius. The average normal body temperature is 37 degrees Celsius, that is 98.6 degree Fahrenheit. Normal adult pulse rate ranges from between option A 40 to 60 beats per minute, option B 60 to 100 beats per minute, option C 100 to 120 beats per minute, option D 30 to 50 beats per minute. The correct answer is option C 60 to 100 beats per minute. A healthy adult pulse rate lies between 60 and 100 beats per minute. The most common site to measure pulse in adult is option A brachial artery, option B femoral artery, option C radial artery, option D carotid artery. The correct answer is option C radial artery. The radial artery at the wrist is the most accessible and widely used pulse rate. Radial artery is the common site to measure pulse in adults. Radial artery at the wrist. The normal respiratory rate for an adult is option A 10 to 12 breaths per minute, option B 12 to 20 breaths per minute, option C 20 to 30 breaths per minute, option D 80 to 10 breaths per minute. The correct answer is option B 12 to 20 breaths per minute. A adult respiration rate is 12 to 20 breaths per minute. The normal systolic blood pressure for an adult approximately option A 120 mm of Hg, option B 100 mm Hg, option C 130 mm of Hg, option D 140 mm of Hg. The correct answer is option A 120 mm of Hg. A normal adult systolic blood pressure averages 120 mm of Hg with diastolic 80 mm of Hg. Which thermometer is used to measure body temperature through the ear? Option A digital thermometer, option B mercury thermometer, option C tympanic thermometer, option D glass thermometer. The correct answer is option C tympanic thermometer. A tympanic thermometer measures temperature through the ear canal reflecting core temperature. The pulse felt on the neck is called option A carotid pulse, option B radial pulse, option C brachial pulse, option D femoral pulse. The correct answer is option A carotid pulse. The carotid pulse located in the neck is used especially during emergency to assess circulation. The pulse felt on the neck is called carotid pulse. Which factor decreases the pulse rate? Option A exercise, option B hypothermia, option C fever, option D pain. The correct answer is option B hypothermia. Hypothermia reduces metabolic activity and heart rate, lowering the pulse. Hypothermia decreases the pulse rate. Which of the following vital signs is affected first in shock? Option A blood pressure, option B respiration, option C temperature, option D pulse. The correct answer is option A blood pressure. In shock, blood pressure drops early due to poor tissue perfusion and low cardiac output. Blood pressure is the first vital signs. The normal diastolic blood pressure for an adult is option A 60 mm of Hg, option B 70 mm of Hg, option C 80 mm of Hg, option D 90 mm of Hg. The correct answer is option C. A healthy adult's diastolic pressure usually averages 80 mm of Hg, representing the pressure when the heart rests between beats. Normal diastolic blood pressure for adult is 80 mm of Hg. The instrument used to measure blood pressure is called option A thermometer, option B stethoscope, option C spirometer, option D sphygmomanometer. The correct answer is option D. A sphygmomanometer is a medical instrument used to measure blood pressure, often with stethoscope. The instrument used to measure blood pressure is The normal temperature ranges in Fahrenheit is option A 95.4 to 97.0 degree Fahrenheit, option B 98.4 to 99.5 degree Fahrenheit, option C 97.0 to 99.5 degree Fahrenheit, option D 96.0 to 100.5 degree Fahrenheit. The correct answer is option C. The normal. Which of the following increases body temperature? Option A starvation, option B sleep, option C exercise, option D cold exposure. The correct answer is option C exercise. Exercise increases metabolism and muscle activity, leading to a rise in body temperature. Exercise increases the body temperature. The apical pulse is located option A in the wrist, option B over the carotid artery, option C on the chest below the nipple, option D behind the knee. The correct answer is option C on the chest below the nipple. The apical pulse is found at the fifth intercostal space just below the left nipple line head using a stethoscope. The pulse rate is best assessed for 1 full minute when option A patient is awake, option B pulse is irregular, option C patient is resting, option D patient is asleep. The correct answer is option B pulse is irregular. When a pulse is irregular, it must be counted for a full minute to ensure accuracy. Pulse is assessed best when it is irregular. Which artery is commonly used to measure blood pressure? Option A radial artery, option B brachial artery, option C carotid artery, option D femoral artery. The correct answer is option B brachial artery. The brachial artery in the upper arm is the standard site for measuring blood pressure using a cuff. Brachial artery is commonly used to measure blood pressure. Which factor increases pulse rate? Option A hypothermia, option B sleep, option C fever, option D hypoxia. The correct answer is option C fever. Fever rises body metabolism and oxygen demand, increasing pulse rate. Fever increases pulse rate. Rises the normal temperature in axilla armpit is usually option A 37.5 degrees Celsius, option B 36.5 degrees Celsius, option C 38 degrees Celsius, option D 35 degrees Celsius. The correct answer is option B. Axillary temperature is about 0.5 degrees Celsius lower than oral temperature, averaging 36.5 degrees Celsius. The pulse rate in a newborn is usually option A 60 to 100 beats per minute, option C 70 to 110 beats per minute, option C 80 to 120, option D 120 to 160 beats per minute. The correct answer is option D. A newborn's pulse is much faster, ranging between 120 and 160 beats per minute. The normal respiration rate in a newborn is option A 10 to 20 breaths per minute, option B 20 to 30 breaths per minute, option C 30 to 40 breaths per minute, option D 15 to 25 breaths per minute. The correct answer is option C 30 to 40. A newborn normally breathes 30 to 40 times per minute, which is faster than adult due to higher metabolism. Which of the following is a sign of bradycardia? Option A pulse rate 100 beats per minute, option B pulse rate 80 beats per minute, option C pulse rate 60 beats per minute, option D 50 beats per minute. The correct answer is option D. Bradycardia means slow heart rate, generally below 60 beats per minute in adult. Which of the following is a sign of tachycardia? Option A pulse rate 40 beats per minute, option B pulse rate 60 beats per minute, option C pulse rate 90 beats per minute, option D pulse rate 120 beats per minute. The correct answer is option D pulse rate 120 beats per minute. Tachycardia is defined as pulse rate over 100 beats per minute in adult. The normal range of oral temperature. Option A 35 to 36 degrees Celsius, option B 36 to 37.5 degrees Celsius, option C 37.5 to 38.5 degrees Celsius, option D 35.5 to 37 degrees Celsius. The correct answer is option B. Oral temperature normal ranges between 36.5 to 37 degrees Celsius. Which of the following is not a factor affecting body temperature? Option A exercise, option B age, option C gender, option D environment. The correct answer is option C gender. Temperature is influenced by age, activity and environment, not by gender. Thank you. Which pulse site is used during cardiac arrest for adults? Option A radial artery, option B carotid artery, option C femoral artery, option D temporal artery. The correct answer is option B carotid artery. During cardiac arrest, the carotid pulse in the neck is checked for detection of circulation. Which of the following can cause an increase in respiration rate? Option A sleep, option B pain, option C meditation, option D rest. The correct answer is option B pain. Pain stimulates the sympathetic nervous system leading to faster breathing, that is tachypnea. Which method is least accurate for measuring body temperature? Option A oral, option B rectal, option C tympanic, option D axillary. The correct answer is option D axillary. Axillary underarm temperature is least accurate, often lower than the core temperature. Axillary method is least accurate for measuring body temperature. Which of the following vital signs is controlled by medulla oblongata? Option A blood sugar, option B respiration, option C reflexes, option D posture. The correct answer is option B respiration. The medulla oblongata regulates respiration, heart rate and blood vessel diameter. Respiration controlled by medulla oblongata. Which of the following conditions lowers body temperature? Option A fever, option B infection, option C hypothermia, option D exercise. The correct answer is option C hypothermia. Hypothermia occurs when body temperature drops below 35 degrees Celsius, often due to cold exposure. When recording pulse, which characteristic is not noted? Option A rate, option B rhythm, option C volume, option D color. The correct answer is option D color. Pulse is assessed for rate, rhythm and volume, not for color, which is a skin sign. Color is not a characteristic when recording pulse. Which site is most commonly used for measuring temperature in infant? Option A oral, option B axillary, option C tympanic, option D rectal. The correct answer is option B axillary. In infant, temperature is safest measured at the axilla, avoiding injury or infection risk. Axillary, the best time to measure resting pulse is option A after meals, option B during exercise, option C after sleep, option D during stress. The correct answer is option C after sleep. The resting pulse is most accurate when the person is relaxed and calm, such as after sleep. Blood pressure is measured in option A centimeter of mercury, option B gram per square centimeter, option C millimeter of mercury, option D Pascal. The correct answer is option C millimeter of mercury. Blood pressure is recorded in millimeters of mercury. A body temperature above 100.4 degree Fahrenheit is called option A normal, option B hypothermia, option C fever, option D heat exhaustion. The correct answer is option C fever. A temperature of 100.4 degree Fahrenheit or above indicates fever or pyrexia. Which pulse site is located in the groin? Option A radial, option B femoral, option C carotid, option D apical. The correct answer is option B femoral. The femoral pulse is found in the groin area, often used to assess circulation in lower limbs. Femoral is a pulse site is located in the groin. Which condition causes irregular breathing patterns? Option A fever, option B brain injury, option C exercise, option D anger. The correct answer is option B brain injury. Brain injury affecting respiratory center in the medulla can cause irregular breathing patterns. Brain injury causes irregular breathing patterns. Which of the following is used to count respiration? Option A sphygmomanometer, option B stethoscope, option C observation, option D ECG. The correct answer is option C observation. Respirations are counted by observation, noting chest rise and fall for 1 full minute. Respirations are counted by observation. Which pulse site is used in infant for accuracy? Option A radial, option B apical, option C brachial, option D temporal. The correct answer is option B apical. In infant, the apical pulse over the heart gives most accurate heart rate. Apical is the pulse that is used in the infant for accuracy. What is the normal blood pressure range for adults? Option A 100 by 70 mmHg. Option B 120 by 80 mm of Hg. Option C 140 by 190 mm of Hg. Option D 160 by 100 mm of Hg. The correct answer is option B 120 by 80 mm of Hg. The condition of rapid breathing is known as A. Bradypnea. Option C tachypnea. Option C apnea. Option D dyspnea. The correct answer is option B tachypnea. Tachypnea means rapid breathing, usually more than 20 breaths per minute in adults. The condition of rapid breathing is known as tachypnea. The absence of breathing is called option A dyspnea, option B apnea, option C apnea, option D orthopnea. The correct answer is option A apnea. Apnea refers to temporary absence of breathing as seen in sleep apnea or respiratory arrest. The absence of breathing is called apnea. The term used for normal breathing is option A dyspnea, option B apnea, option C tachypnea, option D apnea. The correct answer is option B apnea. Apnea means normal, regular, and effortless breathing. Term used for normal breathing is apnea. Which of the following is a sign of dyspnea? Option A difficulty in breathing, option B slow breathing, option C fast pulse, option D shallow breathing. The correct answer is option A difficulty in breathing. Dyspnea is the term for difficulty for labored breathing, commonly seen in asthma or heart failure. Sign of dyspnea difficulty in breathing. A fever that comes and goes is called option A continuous fever, option B intermittent fever, option C remittent fever, option D relapsing fever. The correct answer is option B intermittent fever. In intermittent fever, the term rises and falls periodically, returns to normal between episodes. Pulse rate increases due to option A sleep, option B shock, option C fever, option D rest. The correct answer is option C fever. Fever increases the metabolic rate and heart rate, leading to an increased pulse rate. Pulse rate increases due to fever. The pulse rate is lower in option A fever, option B exercise, option C sleep, option D anxiety. The correct answer is option C sleep. During sleep, body functions slow down, causing pulse rate to decrease. The pulse rate is lower in sleep. Which of the following is not part of vital signs? Option A temperature, option B respiration, option C pulse, option D weight. The correct answer is option D. Weight is not a vital sign, though it is routinely measured. Vital signs include T, temperature, pulse, respiration, blood pressure. Weight is not a vital sign. Which factor causes an increase in blood pressure? Option A dehydration, option B exercise, option C sleep, option D shock. The correct answer is option B exercise. Exercise temporarily raises blood pressure due to increased cardiac output. The factor causes an increase in blood pressure is option B exercise. Which factor causes decrease in blood pressure? Option A anxiety, option B hemorrhage, option C exercise, option D pain. The correct answer is option B hemorrhage. Severe blood loss or hemorrhage leads to drop in blood pressure due to reduced blood volume. Hemorrhage causes decrease in blood pressure. Thank you all. Which of the following statements about rectal temperature is true? Option A, it is lower than oral temperature. Option B, it is equal to axial temperature. Option C, it is higher than oral temperature. Option D, it is same as tympanic. The correct answer is option C. Rectal temperature is about 0.5 degrees Celsius higher than oral temperature and reflects core body temperature. Which of the following is used to assess oxygen saturation? Option A, thermometer. Option B, stethoscope. Option C, pulse oximeter. Option D, ECG machine. The correct answer is option C, pulse oximeter. A pulse oximeter measures oxygen saturation and pulse rate using infrared light. The normal oxygen saturation in a healthy adult is option A 85 to 90%, option B 90 to 92%, option C 95 to 100%, option D 80 to 85%. The correct answer is option C 95 to 100%. Normal SpO2 levels ranges from 95 to 100%, indicating adequate oxygen. The condition of low body temperature is called option A hypothermia, option B hypothermia, option C fever, option D pyrexia. The correct answer is option B hypothermia. Hypothermia occurs when body temperature drops below 35 degrees Celsius, often from cold exposure. What is the normal range of pulse rate in children? Option A 40 to 60, beats per minute, option C 60 to 80 beats per minute, option C 70 to 110 per minute, option D 120 to 160 beats per minute. The correct answer is option C 70 to 110 beats per minute. Children aged 6 to 12 years typically have a pulse rate between 70 to 110 beats per minute. The normal range of respiration for children is option A 10 to 12 breaths per minute, option B 12 to 20 breaths per minute, option C 20 to 30 breaths per minute, option D 30 to 40 breaths per minute. The correct answer is option C. Children breathe faster than adults with 20 to 30 breaths per minute being normal. Which of the following is a characteristic of pulse? Option A color, option B volume, option C texture, option D size. The correct answer is option B volume. Pulse characteristics include rate, rhythm and volume. Color and size are not pulse parameters. What is the purpose of measuring vital signs? Option A to record growth, to check infection, to assess body function. Option D to diagnose disease. The correct answer is option C to assess body function. Vital signs help assess the body's physiological functions and detect early signs of illness. To assess body function is the purpose of measuring vital signs. The pulse rate is usually higher in option A athletics, option B children, option C adults, option D elderly. The correct answer is option B children. Children have a high pulse rate than adults due to faster metabolism and smaller heart size. Children has high pulse rate than adults due to faster metabolism. Which of the following indicates normal body temperature? Option A 36.5 degrees Celsius, option B 35 degrees Celsius, option C 38 degrees Celsius, option D 39 degrees Celsius. The correct answer is option A 36.5 degrees Celsius. A body temperature of 36.5 degrees Celsius is within normal range, that is 36 degrees Celsius to 37.5 degrees Celsius. Which artery is commonly used to measure the pulse in infants? Option A radial artery, option B brachial artery, option C carotid artery, option D temporal artery. The correct answer is option B brachial artery. In infants, the brachial artery inside the upper arm is most accessible and safe for pulse measurement. A pulse rate below 60 beats per minute is termed option A tachycardia, option B bradycardia, option C hypertension, option D arrhythmia. The correct answer is option B bradycardia. Bradycardia refers to slow heart rate less than 60 beats per minute. A pulse rate below 60 beats per minute is called bradycardia. The most accurate site for measuring core body temperature is option A oral, option B axillary, option C rectal, option D tympanic. The correct answer is option C rectal. Rectal temperature closely reflects core body temperature, making it is the most accurate site. The most accurate site for measuring core body temperature is option C rectal. The instrument used to listen the heart and lungs is option A thermometer, option B stethoscope, option C pulse oximeter, option D sphygmomanometer. The correct answer is option B stethoscope. A stethoscope is used to auscultate heartbeats, lung sounds and bowel sounds. The instrument used to listen heart and lung sounds is option B stethoscope. The condition of high blood pressure is called option A hypertension, option B hypertension, option C bradycardia, option D tachycardia, tachypnea. The correct answer is option B hypertension. Hypertension is a condition where blood pressure remains persistently above normal levels, that is 140 by 90 mm of Hg. The condition of low blood pressure is called option A hypertension, option B hypertension, option C arrhythmia, option D bradycardia. The correct answer is option B hypertension. Hypertension means low blood pressure, usually below 90 by 60 mm of Hg. The normal pulse rate in an adult female is usually option A 55 to 65 beats per minute, option B 60 to 70 beats per minute, option C 70 to 80 beats per minute, option D 80 to 90 beats per minute. The correct answer is option C. Females generally have a slightly higher pulse rate, that is 70 to 80 beats per minute, than males. Which factor doesn't affect pulse rate? Option A age, option B emotion, option C gender, option D height. The correct answer is option D height. Pulse rate is affected by age, exercise and emotions, not by height. Factors doesn't affect pulse rate is option D height. Which of the following increases respiratory rate? Option A sleep, option B fever, option C cold exposure, option D relaxation. The correct answer is option B fever. Fever raises the body metabolic demand, causing increase in breathing rate. Which of the following increases respiratory rate? Correct answer is option B, fever. Which type of thermometer gives an instant digital reading? Option A, mercury thermometer. Option B, digital thermometer. Option C, alcohol thermometer. Option D, clinical glass thermometer. The correct answer is option B, digital thermometer. Digital thermometer provides fast electronic readings and is safer than mercury ones. Digital thermometer gives an instant. The blood pressure cuff should cover option A, the entire arm. The option B, two-thirds of the upper arm. Option C, half of the upper arm. Option D, one-third of the arm. The correct answer is option B, two-thirds of the upper arm. For an accurate reading, the BP cuff should cover two-thirds of upper arm and encircle 80% of arm circumference. Which of the following can cause false high BP readings? Option A, loose cough. Option B, too small cough. Option C, arm below heart level. Option D, patient lying flat. The correct answer is option B, too small cough. A too small cough compresses the arm more, giving a falsely high blood pressure reading. What should be done before taking oral temperature? Option A, give hot water. Option B, wait 15 to 30 minutes after eating or drinking. Option C, ask to breathe deeply. Option D, take BP first. The correct answer is option B, wait 15 to 30 minutes after eating or drinking. After eating, drinking, smoking, wait 15 to 30 minutes before taking oral temperature to avoid false readings. Which of the following is the pulse rate in a resting adult male? Option A, 60 to 70 uh, beats per minute. Option B, 70 to 80 beats per minute. Option C, 80 to 90 beats per minute. Option D, 100 to 110 beats per minute. The correct answer is option A. A normal adult male pulse is about 60 to 70 beats per minute. Which of the following factor increases blood pressure temporarily? Option A, sleep. Option B, anxiety. Option C, shock. Option D, hydration. The correct answer, dehydration. The correct answer is option B, anxiety. Anxiety or emotion stress stimulates sympathetic system, causing temporary rise in blood pressure. Thank you all. When recording respiration, the nurse should option A, inform the patient. Option B, count after telling the patient. Option C, count without the patient knowledge. Option D, take while patient talks. The correct answer is option C, count without the patient knowledge. Respiration should be counted discreetly because patient may alter breathing if they know it is being observed. The temperature measured under the tongue is called option A, rectal temperature. Option B, oral temperature. Option C, axillary temperature. Option D, core temperature. The correct answer is option D, oral temperature. Temperature taken under the tongue is the oral temperature commonly used in adults. The temperature measured under the tongue is called oral temperature. Which pulse site is used for emergency assessment in children? Option A, radial artery. Option B, carotid artery. Option C, temporal artery. Option D, dorsalis pedis artery. The correct answer is option B, carotid artery. In children, the carotid artery is checked during emergencies to assess cardiac activity. Pulse site is used for emergency assessment. The term febrile refers to option A, without fever. Option B, with fever. Option C, low temperature. Option D, cold sensation. The correct answer is option B, with fever. Febrile means having a fever, while afebrile means without a fever. Febrile means having a fever, afebrile means without fever. The condition of difficult or labored breathing is called option A, apnea. Option B, dyspnea. Option C, eupnea. Option D, orthopnea. The correct answer is option B, dyspnea. Dyspnea means difficulty in breathing, often seen in conditions like asthma or COPD. Condition of difficult or labored breathing is called dyspnea. Can see in asthma or COPD. What is the normal pulse pressure in adults? Option A, 10 mm of Hg. Option B, 20 mm of Hg. Option C, 40 mm of Hg. Option D, 60 mm of Hg. The correct answer is option C, 40 mm of Hg. Pulse pressure. Difference between systolic and diastolic blood pressure is normally about 40 mm of Hg, that is 120 minus 82 is equal to 40. Which pulse site is located at the top of the foot? Option A, radial artery. Option B, femoral artery. Option C, dorsalis pedis artery. Option D, popliteal artery. The correct answer is option C, dorsalis pedis artery. The dorsalis pedis pulse is found on dorsum of the foot, used to assess peripheral circulation. Which pulse is felt behind the knee? Option B, radial artery. Option B, brachial artery. Option C, popliteal. Option D, femoral. The correct answer is option C, popliteal. The popliteal pulse is located behind the knee, used to check lower limb blood flow. Popliteal pulse is felt behind the knee. Which pulse site is located in the temple region? Option A, temporal artery. Option B, radial artery. Option C, carotid artery. Option D, femoral artery. The correct answer is option A, temporal artery. The temporal pulse is felt in front of the ear on the temple region of the head. When measuring blood pressure, the first tapping sound heard is option A, diastolic. Option B, systolic pressure. Option C, mean arterial pressure. Option D, pulse pressure. The correct answer is option B, systolic pressure. The first cough sound heard while deflating the cuff represent the systolic pressure. When measuring blood pressure, the last sound heard indicates option A, pulse pressure. Option B, systolic pressure. Option C, diastolic pressure. Option D, mean arterial pressure. The correct answer is option C, diastolic pressure. The disappearance of sound, fifth cough sound, marks the diastolic pressure. The blood pressure should be measured with the arm. Option A, below heart level. Option B, above heart level. Option C, at heart level. Option D, extended above the head. The correct answer is option C, at heart level. For accurate BP reading, the arm should be at the same level as the heart. The blood pressure should be measured with the arm at heart level for accurate reading. The normal temperature range in Celsius is option A, 35 degree Celsius to 36 degree Celsius. Option B, 36 to 37.5 degree Celsius. Option C, 38 degree to 39 degree Celsius. Option D, 37.5 to 39 degree Celsius. The correct answer is option B. The normal human body temperature is 36 to 37.5 degrees Celsius. Which of the following can cause falsely low BP reading? Option A, small cough. Option B, large cough. Option C, tight cough. Option D, patient anxious. The correct answer is option B, large cough. A too large cough may not compress the artery enough, giving a falsely low BP reading. Which vital signs is usually measured first? Option A, pulse. Option B, temperature. Option C, blood pressure. Option D, respiration. The correct answer is option B, temperature. In most nursing procedure, temperature is measured first, followed by pulse, respiration, and BP. Temperature is the first vital signs measured during nursing procedure. Which condition is characterized by a body temperature above 40 degrees Celsius? Option A, fever. Option B, hyperpyrexia. Option C, hypothermia. Option D, subnormal temperature. The correct answer is option B, hyperpyrexia. Hyperpyrexia is an extremely high fever when body temperature exceeds 40 degrees Celsius. What is the medical term for low body temperature? Option A, pyrexia. Option B, hypothermia. Option C, hypothermia. Option D, febrile. The correct answer is option B, hypothermia. Hypothermia refers to abnormally low body temperature below 35 degrees Celsius. Hypothermia is a medical term for low body temperature. Which of the following can cause bradypnea? Option A, exercise. Option B, sleep. Option C, fever. Option D, pain. The correct answer is option B, sleep. Sleep slows down body metabolism, leading to slower breathing, that is bradypnea. The respiratory rate in tachypnea is option A, less than 12 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, about 20 breaths per minute. Option D, 10 breaths per minute. The correct answer is option C, about 20 breaths per minute. Tachypnea means rapid breathing, usually more than 20 breaths per minute in adult. Which factor increases the body temperature? Option A, fasting. Option B, exercise. Option C, sleep. Option D, cold exposure. The correct answer is option B, exercise. Exercise increases metabolism and heat production, raising body temperature. Exercise increases body temperature. The artery used for checking BP in the thigh is option A brachial artery, option B femoral artery, option C popliteal artery, option D radial artery. The correct answer is option B femoral artery. The femoral artery in the thigh is used when upper arm measurement is not possible. The femoral artery in the thigh is used when upper arm measurement is not possible. A pulse deficit occurs when option A apical and radial pulse are equal. Option B apical pulse is higher than radial. Option C radial pulse is higher than apical. Option C both are absent. The correct answer is option B. Pulse deficit means the apical pulse exceeds the radial artery, often seen in arrhythmias. The normal oral temperature in Fahrenheit is option A 97 to 99 degree Fahrenheit, option B 95 degree to 96 degree Fahrenheit, option C 99 to 101 degree Fahrenheit, option D 100 to 102 degree Fahrenheit. The correct answer is option A. The normal oral temperature range is 97 degree Fahrenheit to 99 degree Fahrenheit. That is which pulse site is checked in CPR for adults? Option A radial, option B carotid, option C femoral, option D temporal. The correct answer is option B carotid. During CPR in adults, the carotid pulse is checked for 5 to 10 seconds to assess circulation. Cardiopulmonary resuscitation. The abbreviation TPR in nursing stands for option A total pressure rate, option B temperature pulse respiration, option C temperature pressure respiration, option D total pulse rate. The correct answer is option B. TPR is the standard abbreviation for temperature, pulse and respiration, which are primarily vital signs. Thank you all.